Hi, I'm David Hanning. Today we're looking at a study that was done by dental imaging consultants out of San Antonio, Texas, that compared several sensors and phosphor plate imaging systems using a phantom that they had developed. And the phantom looks like this. It's a device for measuring the quality given different objective criteria, like varying diameter wells here that are the same depth, and varying the same diameter wells that are varying depths, and a line pair per millimeter gauge here, as well as a aluminum step wedge at the top that's used to see when you get ideal exposure level for the sensor. So we're using this as a follow-up study on the study that dental imaging consultants had done. SUNY has contracted me to do that to see how their sensor fares against the Dexis Platinum sensor, which is right here, and the Kodak 6100 sensor. Both of these sensors fared very well in dental imaging consultants' study, and SUNY, although SUNY fared well also, we think that we can actually get better results doing a little bit of software tweaking, and we wanted to make sure that we had an opportunity to do that testing to see if the results would be better. So that's what we're doing today for SUNY, and we will show you our comparative analysis between the three sensors a little bit later. Now, to put a sensor in here, you simply loosen these wing nuts here. This is spring loaded, so you can slide this back and slide your sensor underneath the little ears that stick out to hold it. We make sure that it's even, and once it's even, we tighten these down. And now the sensor will be held in this testing apparatus, so we can put the tube head over it and have a consistent distance from the sensor. And I've got that centered so we have full exposure. We're using over here a ProStyle Intra Planmeca X-ray tube. It's recently been tested to show that it is firing consistently. And we're going to take everything at a 63 kV. This head actually goes down to a 0.01 exposure. That's the lowest that it will expose at, and we're going to start taking those images at a 0.01. So we've got the Kodak sensor put into the phantom. We're now going to trigger the Kodak by pushing this button. And you'll see RVG acquisition comes up. And I'm going to take this first image at an exposure of 0.01. So that's a very, very low exposure. And you'll see how light the image is being returned. It's not enough exposure because all of the steps on the step wedge are not showing. So we're going to take the next image and we're going to boost it up to a 0.02. So this is a 0.02 on our controller. And now we're going to take the next image. It's going to be returned. Still light. We're going to increase it now to a 0.03 on the controller for exposure. Now we're going to take the next image. And there's the 0.03. We're now going to go to a 0.04 on the exposure level. We're now able to see the scale, but I have a feeling we're going to have to go a little bit higher. We're taking this at a 0.05. So we're going to take it to a 0.06. And the 0.06 is probably a good setting, but we're going to go up to a 0.08 to just take that slightly higher level. Okay, so now we have settings going from a 0.01 to a 0.08. And you'll notice the 0.01, not enough penetration really to see the grayscale differences here. You barely see them. And at the 0.08, the other end of the scale, we can see all the grayscale all the way to black. So 0.08 is what we're going to say is the properly exposed image. Now we're going to close that, and we're going to get the Dexis Platinum sensor, and we're going to do the same exercise with the Dexis Platinum. With the Dexis Platinum, we're going to use the same exposures, 0.01, 0.02, 03, 04, 05, 06, and 08. And so I'm going to take the Kodak sensor out of the Phantom, simply loosen the holding device. I'm going to put the Dexis sensor into the Phantom. Make sure we have full coverage on the changing depth well, so I'll put it over to the edge because it is a little bit smaller here. Tighten that down. Slide that in. Now we will plug in the USB on the Dexis sensor. We will use Dexis's software to acquire these images. So I'm going to close here. We'll go into Dexis 10, the newest version of Dexis. We have a test patient we can use. And then we've got our images now that we can use in a comparative study between these three sensors to see what details you're able to see with one versus another. Now we will be analyzing this with our naked eye, so we're not going to be using software per se to look at the differences, although in the study that dental imaging consultants did, they did use software to look at the differences between the sensors. We're going to be using our naked eye just as a dentist would, who would be using these sensors on a daily basis. So we have our test where we've done different post-processing through the SED file. Now this is interesting. So the images that were returned with this different post-processing filter that we have, I think it makes it easier for sure to see the changing diameter wells and the changing depth wells without any tools applied. So here you'll notice these images, the ones that were taken at the same exposure level, 03 is what we said was pretty much the ideal exposure. And so these images were all taken at an 03. Now, the difference, this one had a little bit more gamma correction, and in fact, this image was post-processed at a -5 brightness, -5 contrast, and a 75 gamma, which is where Suni sets their processing typically in their SED5. And their sharpening as well, we turn the sharpening off. If I go into these settings that we're talking about here, the last images that we took over here on the left, I went ahead and I said let's allow median noise filtering, use thorough median to remove a little bit of the noise that you have. And then I set the brightness to a -7, the contrast to a 5, and the gamma correction to a 0.70. And this was our resulting image. So this image is with no correction whatsoever. So it's a 0 across the board. And you can see everything looks very faint there. You really can't distinguish the changing diameter wells. That's this area right here, and I'm going to use a tool that you will be able to see them. 1, 2, 3, 4, 5, and 6 is out there, just on the other side of 17. It's real small. And then the changing diameter, or the changing depth wells, right underneath the changing diameter. 1, 2, 3 is starting to get a little blotchy. There's a little shadow for where 4 is, and actually if you bring that down you can see 4 right there. And 5 should be right across from the 5th dot, and you see something there. Again, University of Texas in their testing, they did not see those wells out there. And we'll look at the Dexis and the Kodak image where they did see them and see how they look in those images. Now here in our SED, 3 with the noise removal. And again, I would agree that out here they're very hard to see, but I don't know if that is the shadowed one. I believe it is, right across from that. But here you can see with your naked eye, it's easier to discern the change. I believe the changing diameter wells in this image than it is here, because everything here is relatively a little bit lighter. Now let's close this. And we'll go ahead and tile these two side by side. And we'll look at this. The only difference between these two is this has a little bit of noise removal, and the other one does not have the noise. This does not have noise removal. So let's see if we can even see the difference. If I magnify there, you see some of that noise in the gray square, and it's not quite as noisy in this image. So again, we don't want to remove detail when we do that. We want to make sure that we are not creating things that aren't there or removing things that are there. So, this is where we come down to nuances and things that we can change. Again, we're running a thorough median noise reduction in this image versus this no noise reduction. So are we going to be offering the clinician more detail with the noise reduction and clarifying what they're able to see? And is that something we should put in there? Now the other thing is a little bit of the drop in gamma and increase in contrast and drop in brightness. You can see just the subtle differences between these two images. That's something that we can affect as well. But we have to be careful in terms of how much of that we do to make sure that we're not subtracting information or adding information in that process. So these are, let's go ahead now and pull up for comparative purposes, and we're looking at it in the same software, although we can show the images in their native software. We'll pull up the Dexis images and the Kodak images, and I think that we're going to use this frame on the left, which were the images taken with our current post-processing, which was -7 brightness, a 5 contrast, a 70 gamma, and a little bit of noise reduction. And there it is. Okay. So what we'll start off looking at is we're going to notice here, all of these were taken starting at 0.01. This is not labeled yet because it's a new SED file that we used. But this, all of them were taken 0.01, 0.02, 0.03, 0.04, 0.05, 0.06. Then it went to 0.08, 0.10, 0.12, and 0.16. With the Suniray, we stopped at 0.10 because it was so burnt out, there was no reason to continue on that. And from these exposures, we determine which one. Let's look at the very first one, 0.01. So here you'll notice with the Kodak image, it's so washed out from not having enough exposure to penetrate to the sensor that you can barely see anything. The Suni image shows all of the grayscale, but it is a little bit noisy, and you can see the noise. When you do the magnification here, you'll see the noise within there. Same with the Dexis image. Dexis image is even noisier, but again, it is displaying all the grayscale on the step wedge. So here, if we go to the next one with the Kodak and 0.02 with the Suni, in our .02 with the Dexis. You'll see that the Suni is getting towards that correct exposure. You can start to see the varying diameter wells down here, but it is still a little bit noisy, a little bit grainy. The Dexis still, noisy, grainy. The Kodak, obviously, not even close. When you think about it, this is what we're talking about. That first image was a .01 on the timer. That's the amount of radiation, a tenth of a second, or 1/100th of a second of exposure. The second one was a .02. And so we keep going up here, increasing the time of exposure of the radiation emission. And right now we're at .03, and the Suni at .03 is the next one here. It's right here. And the Suni at a .03, that's the correct exposure for the Suni. And if you notice, let's go to the magnifier and let's look at first Kodak. It's still not even close. The Suni is smooth, showing all of the transitions of the grayscale from white to black. You can see these changing diameter wells there. The Dexis is still a little bit noisy at that .03, so I mean they probably would not want their image being evaluated at a .03 because it's not going to give you the best quality if there's not enough exposure. Now, oddly enough, the grayscale up here does look correct, but when I was reviewing this image with Dr. Peter Ma, who works with the University of Texas, or actually dental imaging consultants, they're the ones that created the phantom here that we use for our testing, he said that we really needed to go up one exposure level and that the correct exposure would be a .04, which I agree with him on, because if you look at the image, you'll notice it's nice and clean. You don't have the noise in there. You can see very clearly the first 4 all the way to 5 on the varying diameter just through the magnifier. So I think now let's go with the Kodak and see what we have to take to get there, because here we're at .03 and here we're at .04. So let's go with the Kodak, and it's not until here's .06, and notice that's still light. So the next one at .08 is where we start to see all the grayscale, and the image is nice and smooth within the magnifier. You can see here as we're going down, you can see with the naked eye the changing diameter wells, although you can't see them real well. To me, I mean, you can pretty much see them all about the same with the naked eye. Maybe the Dexis is slightly better out here in this range. But again, looking at the images, I won't say there's a huge difference amongst any of them. However, let's keep in mind exposure. The Suni was 0.3 for its ideal exposure. The Dexis, we had to go up to 0.4 for its ideal exposure. And the Kodak, get this, was 0.08. So it's double the Dexis and almost 3 times what the Suni takes on the exposures. So the Kodak and the Dexis are certainly 2 of the top sensors on the market, and I think the image quality that you get from them is fine. The Kodak certainly, as we can see here, takes a significant amount of radiation, more radiation than the Suniray to expose. So if we go back here, we're going to look at another tool here that's very helpful called the spot enhancer. And this changes the contrast within the spot. We're going to make it very large here. We're going to look first, and actually I'm going to make it just large. We're going to look first on the Kodak image. And here you can see the changing depth, constant diameter wells. So they have the same diameter, but they have a changing depth. They're right below the changing diameter wells. So here, I think you can clearly see 1, 2, you know, the third out there, if it's right below, you can see a portion of it. I believe, I don't know that that would necessarily qualify. It's not showing it clearly. But again, this is where the University of Texas used software analysis to come back and say how many wells you could see and how many change in diameter, what the line pair was, etc. And here we're doing the analysis just through our naked eye and trying to take a little more of a practical approach. Part of it, of course, is we don't have their testing software right now. Later we are going to get that and run these images through the testing software and see if it matches up what we're thinking with our naked eye. But the Kodak image here,
isn't it significant, David, that the doctor is going to use his naked eye to look at the images?
Yeah, and I think that's, Joel, that's a good point. You know, we're looking at this as if a clinician came in and we're looking at an x-ray with their naked eye. We're using a lot of the tools that oftentimes they don't use just because they don't have the time, or maybe they're seeing what they need to see in the x-ray anyway. So yeah, we're taking more of that analysis with the images. I think it will be interesting later to run these through the software though and see if what we see corresponds to what the software sees. So here, let's go to this image, the Kodak, and we're going to use the spot enhancer. And notice it changes the contrast here. If I pull it down, I can see clearly changing diameter and depth on those first three, 4 on the changing diameter. And again, whether that shadow that is a little bit irregular, if you want to give it to it on that, I would say it's questionable in terms of the naked eye if you would pick that up and discern it as a changing diameter well if you didn't know what it is. But it is starting to fade, certainly. There's 5. And the 6th, I know, is out there somewhere. I'm not really seeing it. I'm seeing, let's see, 1, 2, 3, 4, 5. There's 5. I'm not really picking up 6 on the change in diameter. I would say it's safe to say 4 maybe on the changing depth if you give it that one. And again, you could almost, because you have this smear, you can almost say, okay, maybe that's a changing depth, but you can't see the diameter. You're not really, you lose the diameter, the exact diameter discernment after the second one, I think, and the third becomes sort of blotchy. So that's the Kodak. And you know, again, if you say that these little smudges are the wells, then you could take it all the way out to 5, but I think practically speaking 3 to 4 on the changing depth wells and certainly 5 on the changing diameter. Okay, let's look at the Dexis next. So the Dexis over here, I can see definitely, and they're more clearly defined, the first 3 no question, 4, you can see there the 4th is defined, 5 on the changing diameter, and actually the changing depth, you can see a little bit of a shadow down there on that. And then there's the 6th dot. I don't really see anything for the changing depth well, but I can certainly see with this tool 5 changing diameter, or actually 6, and 5 changing depth, same diameter. Now let's look at the Suniray here in the middle. Okay, 1, 2, 3. You can see all the way out there, and now 3, 4. On 4 changing diameter, 5 changing diameter. I'm not really seeing or picking up the changing depth wells as much there, but let's drop it. Actually, if I drop right here, I do see one. So I'm seeing a little bit of a shadow as on the other one, the Kodak. And certainly I can see clearly out to 5 changing diameters. So 1, 2, 3, 4, 5. 1, 2, 3. It's odd. I can make out the fourth changing depth well here, but I can't really see it quite as well here in the third position. And I know they said you should be able to see it in both. So that's that portion of it. Now let's, and I guess if I had to look at this, I would say with the tool, the Kodak and the Suni are very close. The Suni can see all the way out here. 1, 2, 3, 4, 5, perhaps 6. I know it's out here in this area, that little smudge. Kodak is seeing about the same thing. The changing diameter, constant depth, or changing depth, constant diameter wells start to get really fuzzy out there, whereas the Suni, they start to get real fuzzy and indistinct out here after 3 as well. The Dexis does appear to be able to show just almost everything there on that. So in terms of the sensitivity of that particular test, I'd say the Suni and the Kodak are very, very close. The Dexis is a little bit above in terms of its sensitivity, especially on the changing depth, constant diameter wells.
And yet, these are different radiation levels.
These are different radiation levels for sure.
So if we were looking at all those at the same radiation level,
well,
so if we had to do it as an example, lowering the Dexis to the same radiation level as the Suni wins the fight.
Right, exactly, and that's a good point, Joel. If you drop the Dexis down to its next point, and let's actually look at that.
At that point, you're comparing apples to apples.
Then you're, in terms of the same exposure, let's take a look at that and let's see what it can. Yeah, see, you actually have lost your changing depth wells after 2. You know, so if you were saying, hey, we're going to shoot everything on and you can't see your 6 spot, you can see 5, but you can see it just barely. So you can see how that makes a big difference when these are all at 03. Now the Kodak wouldn't even be usable at 03. If it had to compete at that level, it would be out of the game because it would be here and you're not seeing anything.
So there's your apples to apples comparison.
There's apples to apples on exposure, certainly. We could say, hey, if they have to use the same exposure, we're going to show superior detail at that exposure level. And then if you take the other image here, and I actually increase the exposure on the Suniray to an 04, and let's see if taking that up a little bit, where you can see our grayscale is not too much different than it is here on the Dexis in terms of the difference here on the last spot. You can see it a little more clearly there, but this would be considered overexposed on the Suniray. But you can see with that little overexposure, you can see all the way out to the 6 dot, 3, 4, 5. You know, so, well, not really. You can, so it with the Suniray going to the correct exposure level of 03, you know, you're seeing what you see with the Kodak at an 08, and the Dexis sees a little more certainly at its ideal at an 04. Now let's look at something here called line pairs per millimeter. And one of the measuring tools on here is a what they call a line pair gauge. And it shows you, see these lines up in my spot magnifier. I'm going to actually tune this down. Okay, here's 6 line pairs. So on the gauge, we can see those clear, light, and dark lines. And as we increase on this gauge, and I'll make sure I get the number in here too, 6, 8, 9, it becomes more difficult to see the separation. But you can still see, I guess, the separation here. Now I would start to question it, and again, when the University of Texas did their testing, they use software to discern the difference here on the line pairs, and apparently the software gave them the results. But on this, I would say I can't see that that's getting beyond, although I see a little bit of separation there. I'd say 12, 13 line pairs is where you are with the Kodak. Let's go down that line a little. Well, and again, I think that's being very generous. You're probably closer to the 12. But we're going to say with our eye that's between 12 and 13. Now let's come over here to the Suni, and we're going to boost our magnification factor. And certainly in the 10, 11 range, I'm still seeing separation on the lines. Towards the 12 and 13, it's no more separation that I can see, but again, software analyzes this. And interestingly enough, the University of Texas concluded that this characteristic, the line pair per millimeter, was really the least important variable. I think it's Suni quotes a actual line pair per millimeter of 15. And both Kodak and Dexis, I don't know that Dexis gives an actual line pair, but I know Kodak 6100 quotes somewhere in the upper 20 range. And Suni is giving a solid 11 line pairs here, so they're giving 75% or more actually of the real line pairs versus the theoretical. Whereas Kodak, that's touting a much higher line pair, is giving about half of what their theoretical is. So I think that's interesting. But again, that factor is not seen as a really super important factor. The more important factor is the way that contrast is shown with the sensor, and you're able to discern differing densities. Which certainly these changing diameter wells and changing depth, same diameter wells are important. But the question is, how do they translate in terms to the diagnostic ability of the sensor? And we will be evaluating that as well later with the Dexter. So here, let's go on to the Dexis sensor. And we're going to, again, look at the line pairs per millimeter. And we're going to start off in the 12 range, clear separation. 13. I'm starting to lose anything at 13. I know the University of Texas said it was 15. But again, I'm starting as we move up here, again, not to see that with this tool. I see all of these as really being in the, I think 11 is clear, 12 is clear. Might begin to lose it there at 13. So it seems like line pair, they're all very, very similar. And I think if you just look at these images, I know they're not teeth, but you look at the grayscale that's being offered there and the line pair gauge, they're also very similar. The thing that does stand out is that they take different amounts of radiation to capture the image. So yeah, we got very similar results on the exposures. I think we got a little more favorable results here on what we can see on the images, at least certainly on the diameter. If I come down here, I can clearly see 1, 2, 3, and 3 changing depth wells as well. 4 on diameter, and then 5 on diameter. And 6 would be a stretch, but clearly 5 changing diameter wells. And I'd say 3 to 4, again, it depends on what they're going to give you in terms of that, but certainly 3 changing depth, constant diameter wells. And the University of Texas had 4 changing diameter wells, 3 changing depth wells. So certainly I think we could get 5, 1 more perhaps. and again, potentially one more on the changing depth, same diameter well. Looking at the differences here, if you were to say that in order to be able to see everything clinically you need to see, you would have to be able to see everything on the Phantom, then all of these sensors would fail because none of them had picked up all 6 of the changing depth wells. Alright, so after we've done our comparative analysis today, the one thing that really stands out is that there are a lot of different variables that you're looking at when it comes from looking at one sensor to another sensor. We did get some different results on what we saw with the comparative analysis with the number of changing diameter wells and changing depth wells that you're able to see with this study, although they were all very, very close. There were some very slight differences here. Now what it doesn't tell us, which we'll be conquering in another study, is the actual clinical relevance of what we're seeing here. Now we do have, for example, some things that we can look at. The Kodak sensor required quite a bit more exposure to get a good image than the Dexis sensor and the Suniray sensor. The Suniray required the least amount of exposure, so we did verify Suni's claim that they are the lowest radiation requirement on the market, at least amongst these 3 sensors. And you know, the other thing that it shows us is that in terms of the quality differences that you can see from this study, when images are properly exposed and you know the tools to use in the software to see the information, that the information is there with all 3 of the sensors. Now, when it comes to the edge, if you will, of, hey, I can see one more varying depth well here than I can with this sensor, the question again is, how important is that when it comes to the clinical relevance? The other thing that's important to note is that there's a wide range in cost from these 3 sensors. You know, the Dexis sensor retails at about $11,000. The Suniray sensor can typically be purchased for around $5,000, and the Kodak sensor goes for anywhere in the $9,000 to $10,000 range. So there's definitely a substantial cost difference amongst all of the sensors. But I think what the study showed us today is when they're properly exposed, that they are capturing a similar amount of information, even with this Phantom that is measuring nuances of information. And the next step is taking this into the clinical environment and seeing exactly what those differences translate into in terms of being able to see decay or not see decay. I'm David Hanning, and thank you for spending the time today to watch this study. You know, as I look at all this and I compile all the information, knowing that what I know from over 20 years in dental imaging and doing the testing that we've done with the Phantom, and evaluating all these sensors, how they connect to the computer, how much they cost, which is a big part of this, I think that you can safely say that the Suniray is the best option. It's the best mix. It's got the lowest price. It's got a replaceable cable to the computer. It's got the lowest exposure of any sensor. And I think that that's very important, and we have to say that again. It's got the lowest exposure of any sensor on the market right now. And the importance of that is low as reasonably achievable. So if I'm showing you diagnostic information and I'm able to do that at a lower exposure than any of the other competitive sensors, if I'm the patient, that's what I want. And if I'm a clinician making the decision to get a sensor, in my mind it's a little bit irresponsible to not keep that in mind. So that's very important, and for that reason, knowing that diagnostically you're not missing anything with the Suniray, knowing that the price is half of what some of the competition is charging, the warranty is as good as all of them and better than some of the others, I don't see how you could say that it wouldn't be the best choice for the patient and the doctor ultimately. That's why that's the only sensor that we carry currently. We could carry a lot of different sensors. Dental TI has chosen to carry one sensor, and that's the Suniray. We don't feel any technology is perfect. Certainly the Suniray is not perfect, but when evaluated amongst its peers and the other sensors on the market, we feel like it's the best balance of price, quality, low exposure, serviceable cable to the computer, and it comes packaged with a great software package, Prof. Suni or X-ray vision, highly customizable, a lot of filters available in it. We can make it with a super easy interface. We feel that it's the best package on the market, and that's why we sell Suni.